Okay, so now on the diastolic side. So we'll talk about aortic regurg and then mitral stenosis, and then we'll spend the rest of the time kind of going over some practice tests and seeing if you guys can identify the valve lesions. So let's talk about aortic regurg. Again, degenerative changes, so older patients or young patients with bicuspid aortic valves can get aortic regurg. Again, infective endocarditis, as we mentioned. And then the ones in bold here you should be aware of. So just like with MVP, patients with Marfan's can get aortic regurg because they get aortic root dilation from their connective tissue disease. Patients who have had aortic dissection can have concomitant aortic regurg. And then patients with syphilis, they get aortitis and can get dilation of that root that will cause aortic regurg. So if you see any of that in the question stem, you should think about aortic regurg. Your exam will have a decrescendo diastolic murmur over Erb's point. So what's Erb's point? I know I mentioned earlier the aortic valve is up here, right upper sternal border. Aortic regurg is the one exception in that you may hear the murmur over the aortic valve area, but really the place you're going to best hear it is Erb's point because of where it radiates. And that Erb's point is the third or fourth intercostal space along the left sternal border. So this is where you're going to hear aortic regurg best. Okay? And then, again, many peripheral pulse findings, including Quincke's pulse that we talked about earlier. And then manipulation of afterload is really the maneuver that they will present if this is a case of aortic regurg, if they're going to present a maneuver. And the intensity will increase with increased afterload. How do you manage AR? Medically, it's mostly about afterload reduction, and then in symptomatic and severe cases, it's a surgical problem, and you fix it with surgery. If you have an asymptomatic patient with severe AR and LV dysfunction, that's another time in which you would want to repair the valve. And this doesn't say it, but obviously if they're going to undergo another surgery like a cabbage or something like that, and they're not symptomatic but they have severe AR, I'm sure the surgeon will probably want to do the valve at the same time.